Hello there, a very good evening and welcome to Let's Talk Politics. I'm your host, Eddie Layne, and of course, this program is dedicated to highlighting the development and progress taking place under the People's Progressive Party Civic Administration. And of course, we use the opportunity also to respond to the lies and misinformation being spread by the opposition. I have with me this evening to discuss a very, very important matter, the matter of the COVID 19, and of course, the vaccination and all the other accompanying measures being taken by the government to ensure that Guyanese remain safe. I have with me the Honorable Dr. Frank Anthony, the Minister of Health, and we are expected to be joined in just a bit by the Honorable Joseph Hamilton, the Minister of Labor. But in the meantime, Minister Anthony, good evening and welcome to the program.
Good evening, and thank you for having me on the program.
I want to get straight into this, Minister, almost immediately, and I want to start by highlighting the fact that as of August 1, the government would have, and your ministry to be particular, would have issued some new guidelines or made adjustments to the COVID 19 guidelines, regulations, so to speak, that govern how the country manages um, the pandemic and how we operate. But we've seen a lot of misinformation, a lot of lies, a lot of attempts to skew what was presented. Chief among them is the opposition, especially trying to paint the picture as though the government is somehow strong arming Guyanese, forcing them to take the COVID 19 vaccine or be denied entry into public buildings and to accuse the private sector and so forth of getting on board with this. Um, Totally ignoring or deliberately even so ignoring the fact that even though there is a requirement for you to be vaccinated to have um, automatic access to government offices and so forth, you still have a choice. Those who are unvaccinated have an opportunity to benefit from the same services that those who are vaccinated um, enjoy. However, there are conditionalities within which this can happen. So I'm going to give you a chance, first and foremost, to maybe highlight the new regulations that take effect that took effect rather from August 1st, and then we're going to dig deeper into our discussions with regards to what is being said and what is the reality.
Well, perhaps we go into that particular part of the discussion. Maybe explain to your viewer that we face a very challenge with COVID 19. And as most persons who have been following what has been happening with the disease would know, is that you have the emergence of variants. And right now, there is a variant called the Delta variant that is now in more than 100 different countries. What differentiates the Delta variant from the, the previous variants is that this one is more infectious, meaning that if you are near to an exposed person, you can easily get the virus. And apart from being more infectious, it is causing more hospitalization, and it is also causing many more deaths. Now, when the analysis was done between those who have been vaccinated and those who have not been vaccinated, it was found among the unvaccinated population that more people would get a more severe form of COVID if you are not vaccinated, meaning that you get infected, you end up in the hospital, and a portion of persons who are in the hospital would end up dying from COVID. So, this is a serious thing. On the other hand, those who have been vaccinated, um, even if they get an infection, and that's, there is that possibility, but even if they get infection, they're not going to have a serious form of the disease, and more than likely, they're not going to die from COVID. So that's an important distinction. In Guyana, we have a lot of people who have taken the vaccine. So we have about 257,384 persons who have taken the vaccine. But there are others, so this is first dose, but there are many others who are still reluctant to get the vaccine. Now, the only way that we are going to get to herd immunity is if we have enough of our population taking this vaccine. Right now, with first dose coverage, we are only at 52.9%, which means that we have to get up closer to 85% if we are going to achieve herd immunity. And that's the simple reason why persons need to get the vaccine, because it's protective, it's going to protect you against getting the disease. And even if you get the disease, that you'll get a milder form of the disease. So that's why we're trying to get people to understand the benefits of vaccination. Now, having said that, on the 1st of August, we implemented some new measures. And those new measures are intended, first and foremost, to protect those who have been vaccinated against the unvaccinated.
You know, in the meantime, you're trying to Doc. You're still there? I think we've lost you for a bit there.
I'm here.
Um, all right. All right. So you outlined there the bottom line of what is the intention with the new measures. It's really to protect the vaccinated from the unvaccinated, and there is significant amount of evidence that prove that persons who are vaccinated are less likely to contract the virus. Um, and even if they do, the impact in terms of the severity of the illness, if you want, it's way less. It is only fair. It is only fair to persons who have made the effort to be vaccinated. It is only fair that you have to protect them now, and that you as much as possible you try to keep them away from becoming infected, because of the fact that even though you're vaccinated, you can be infected. You can contract the virus. The issue here
But
is the severity.
there's a very small chance. There's a very small chance of that happening. But nevertheless, there's a small chance. So we need to understand that. But getting a vaccine protects you. And that is what we want people to understand, that this vaccine is working, it is protecting people, and therefore you should get it. Guyana is in a very fortunate position that the government of Guyana has secured a vaccine for every single adult in the country. And we have a choice. We have three different vaccines to choose from. So you have AstraZeneca, you have Sinopharm, and you have the Sputnik V vaccine that is available. So persons who are desirous of getting the vaccine can come to any one of our vaccination sites. And we do have about 100 vaccination sites that operate on a daily basis. So really, there's no excuse for someone not getting their vaccine.
And interestingly, Doc, when you look at the numbers, when you look at the numbers, a significant percentage of our population would have already, the adult population would have already received the vaccines. The issue, though, is that you still have anti vaxxers, as you call them, out there waging campaigns, trying to dissuade the population, those who are not vaccinated, from being vaccinated, despite. And what is sad is that many of these people who are doing that are people who would have already received their vaccines. So you have a lot of members of the opposition, APNU, AFC, out there waging campaigns, some of them publicly and some of them through whisper campaigns, which and information which coming back to us, and we're aware of who those persons are and what they're doing. I saw, and I'll talk about the past in Linden that I saw yesterday, I think, and the campaign that he attempted to wage in Linden. But you have people like Harmon and the others who are silently, and I saw a extremely hypocritical statement coming from Harmon's office, which stated in part that the opposition continues to encourage people to take vaccines, when they are the very ones, including Harmon, who would have attempted to pour cold water on the vaccination exercise when he raised a whole host of unsubstantiated, unfounded, and ludicrous objections to the use of the vaccines. So that's another dilemma that we found ourselves in, where there are deliberate and sustained attempts to pour cold water, so to speak, or to dampen the aggressive vaccination program.
Eddie, 52.9% of our adult population would have already received the first dose of their vaccine. But as I was explaining earlier, we need to get that number up to about 85% so that, um, we'll get closer to herd immunity. Unfortunately, the opposition chose to use vaccination and to politicize it. And that's not going to help our efforts as a nation to get to herd immunity. For everyone living, I mean, whether you're in Guyana or whichever country you're living in, COVID has really disrupted the lives of people. And if we are going to get back to some sense of normalcy, then we really would have to try our best to get more people vaccinated so that we can get to herd immunity. And when we get to herd immunity, it means that we would, um, you know, get back to some level of normalcy. And that's what we're striving for. If the opposition would really want to help, then one of the things that they should be doing is on a daily basis encouraging people to come out and get vaccination. If they do so, and if they want, the Ministry of Health, we are willing to send vaccination teams out with them so that we can get more people immunized. And not just to talk about vaccination, but to actually go out with the teams and encourage people to take vaccination. So I think we are all in the same thing together, and we really need to have people vaccinated. And if they honestly want to help, this is one way in which they can help. As you know, when we are looking at vaccination by the different regions, Region 10 is one of those areas where we have the least vaccination. While the whole country on average is about 52.9%, Region 10 is just about 16.7%. And therefore, rather than trying to discourage people from vaccination, I think the opposition should spend its energy and time trying to explain to people why they need to be protected, how they can protect their family, and the rationale for getting vaccines.
And that's the important thing. And I mentioned earlier that the very people who are waging the campaign are the people who, many of them, whom have already been vaccinated, and many of them who ensure that their relatives and their loved ones were vaccinated. But they're trying to use the citizens of this country, especially those who would have supported them, as pawns in a scheme to gain cheap political points. That is simply what the opposition is doing, using the very people who voted for them, the very people who ensure that they occupied a few seats in the National Assembly. They're trying to use those people as pawns for their narrow political gain. So, what is the narrative they're selling to them? They're selling to them narratives about vaccines will make you impotent, vaccines will affect your ability to become pregnant. They're selling the narrative that the vaccine somehow, some chip is being inserted into you to track you. And I'm seeing a new narrative. They're using fake Facebook pages and they're using their surrogates. And a new narrative that I'm seeing now is that there is some 10,000 doses of expired Sputnik V. The intention here is to cast doubt in the minds of the people. This is the wickedness that you have coming from the opposition. So they have this fake page that is being run by Rickford Burke and the others, and it's now selling that narrative. And people are, I'm seeing people going, actually commenting, believing this lie. And it's for that reason I thought I bring this to the attention of not just you, but to the nation, that this is the newest narrative that they're selling, that there are some 10,000 doses of expired Sputnik V. The reality is the Sputnik V is not enough sometimes, especially the second dose, for the number of people who are lining up daily to ensure that they have it. But you have a group of people who don't concern about the lives, the well-being of their own supporters, because many of the people who are not taking the vaccines are really supporters of the APNU AFC.
Yeah. You know, it's very unfortunate the position that they're taking. It's reckless, it's irresponsible, and because they're sowing confusion and they're creating doubts in people's mind and making them hesitant, that hesitancy can cost a person's life because they would maybe refuse to get a vaccine, and by refusing to get that vaccine, they get infected, and then maybe they get the more severe form of COVID and they can die from COVID. We have seen cases of that already, unfortunately, but we hope that with programs such as this and programs that we're doing, that people can get the facts and that people would not listen to the persons who are trying to spread rumors and to misinform them, and to get facts and then use the facts to decide what is in their best interests. Because all that you described there is a set of people who are not working in the interests of their constituents or their supporters, but they're working on their own narrow political interests. So we have to get people to understand that this here is not, for us to play cheap politics. This is about protecting people's lives. This is about getting people to stay healthy. And the only way we can do so in this pandemic is to encourage them to get the vaccine. Now, a lot of what you said about the myths that they're peddling, so let's deal with each one of those. That one, if you take this vaccine, you're going to become impotent or infertile. None of the scientific studies or trials or anything that has been done with all of these vaccines have resulted in anyone becoming or infertile. So that's a big myth, and that has been perpetuated. And if you believe that, then that can prevent you from saving your own life. If you believe that and you don't go and get the vaccine, because that has not been scientifically proven. The other myth is that if you take this vaccine, somehow there's going to be a chip in the vaccine, and with that chip, when it come around election time that we're going to press a button and get you to go and vote for PPP. Well, obviously, that's a whole bunch of nonsense because, as we know, these vaccines, how they're made from biological components, and therefore they are about stimulating your immune system so that your immune system can develop antibodies that fight off the infection. Now, it's not the first time people are using vaccines. Vaccines have been around for many, many decades. And I'm sure everyone in this country, at some point in their life, especially during childhood, would have received vaccines. So we are not strangers to vaccines, and we know that they work by protecting us against diseases. And therefore, this vaccine is similar in nature to protect us against COVID 19 in any of the vaccines. There's another one that they've been peddling that says if you take the vaccine, you're to a monkey. Well, there are now about 4 billion people around the world that took vaccines. We haven't seen anyone who got a vaccine and they turn into a monkey. So that's another set of nonsense. Well, this one that you're telling me now about this Sputnik V that we have expired doses, that's a whole load of nonsense too, because all the vaccines that we have, they have good dates, they have not expired, and we have been giving them out in the different regions. We have 100 different sites. We have vaccines at each location, and once you come to them, you have a choice of vaccines. We have AstraZeneca, we have Sinopharm, we have Sputnik V. We have a lot of Sputnik V first dose that is not expired and don't have right now the second dose. And as soon as we get the second dose, if we get it today, by tomorrow, all would go because there's a lot of people waiting. And we are trying as much second dose as possible so that as soon as we get it, we can give it out to people because we know there's a lot of people who are waiting on their second dose vaccines. And so we have been working on that. People that we will be getting another batch of second dose Sputnik vaccines very shortly. And as soon as we get it, we'll let them know.
Thanks, Dr. Anthony, and good evening, Minister Hamilton. You joined us belatedly. I know you're a busy man and you just steal some time to join us this evening. But our discussions have been, Minister, on the whole issue of the myths and the lies and misinformation being spread by the opposition with regards to the COVID-19 vaccines. What is sad, and I made the point earlier, is that many of the people who are peddling the lies and misinformation are the people who are already vaccinated and whose families and friends and loved ones are already vaccinated. But I I want to speak specifically, and before I ask for your initial comments, I maybe drop this one in two. Is for us to have a little look now, at this point in the program, of the new measures that were implemented, and really and truly the objectives behind these measures. And I'm going to come back to you in a bit, Dr. Anthony, but Minister Hamilton, I bring you in here. Uh, First and foremost, your general thought about the misinformation campaign, where deliberate attempts by the opposition to misinform and ill-inform the public, and particularly their supporters about the vaccines, when evidence is there to show that most, if not all, the people who are getting ill are persons who are not vaccinated.
Hi, Eddie. Good night. Frank, good night. Just yesterday morning, I was listening to a program, I think on NBC or some one of the American channels. They were speaking to the wife of a gentleman who died from COVID, whose last text message he sent to his wife is that I'm about to die. I should have taken the damn vaccine. And the wife is explaining that the reason why they didn't get themselves vaccinated because of buying into all of this, the myth surrounding vaccination. And they were waiting to see how vaccination work out with other persons who were already vaccinated. The long and short of all of that is that she has lost her husband, and she was traumatized for the fact that she might have contributed to um, his demise. So, at the end of the day, whilst Frank and Eddie, we can point to the people who were involved in political mischief. Everyone, they have a responsibility to themselves, for themselves, to protect themselves. And for those who are married people, who have children, they have a responsibility to those persons. And all of us, we have relatives and we have a responsibility to those persons. So the blame, I would say, are on both parties, those that are involved in misinformation campaign for political reasons, and the persons themselves who, for whatever reason, they at this moment are hesitant or have refused to take vaccine. And as Minister Anthony just said, vaccination has been with us for decades. And that is why I cannot understand with persons who are refusing or hesitant to take the COVID-19 vaccine. I'm still trying to understand what is the story, what is the reason, their reason, because I haven't been given a proper reason yet as to why. Because all of us, on some one of our shoulders, most people the right shoulders, we have scars of vaccination from since we were a child. So the COVID-19 vaccine is just another vaccine, like all the other vaccines, one to deal with a serious public health disease that is with us in Guyana and around the world. When I was a child, I remember polio was ravaging um, children. And I recall the vaccination campaign vividly. And that is responsible for us in Guyana and around the world. Um, Arresting this public health crisis and saving lives, millions of lives of persons around the world, thousands of lives of children in Guyana. The many countries, and for all of us who travel, even with your passport, as good as it is, you can't enter their country unless you have the yellow book. That is the yellow fever vaccination. And so we are going to a place where no political mischief or no peddling of lies will stop the world from going. Where to enter people's country, you have to present a vaccination certificate. To get on a plane, you have to present a vaccination certificate of COVID-19. along with your passport. And that is where we're going, because the world recognizes um, the importance of measures and the type of protocols to arrest COVID-19, the COVID-19 pandemic. And everything we know, all the sciences, all the people who have done all the research on this matter, they are clear in their mind, in their minds, that the only thing that will take us out of this public health crisis that we're faced with is by vaccination. There's no other measure. So if you look at how rapidly we are moving to a place where you have to put in place these measures. I think this afternoon, whilst coming home, I was listening the news or um, that the judiciary in France agreed with the government because people challenge the measures implemented by the French government with it under the notion of unconstitutional and their civil rights and civil liberties and all that kind of thing. But the court ruled uh, on behalf of the government and the measures the government put in place. And I suspect more of that you will see developing in different countries. So we are moving to where no one and no set of gossip and slander and lies and rumors can hold back the train of doing all things necessary to protect citizens. And as a government, that is our responsibility. We have to do all that is necessary in the face of all of the mischief makers to protect the people of Guyana. That is our oath. That is what we swore to do when we received instruments, all of us, not just the Minister of Health, not just the President and Prime Minister and Vice President, all of us who are members of cabinet and members of the government, we swore to protect the people of Guyana and to do everything possible uh, in that regard. And that is what we will continue to do, and we have to do. We have no other choice as a government.
And thanks, Minister Hamilton. And this brings me. You touched briefly. You talk about attempts to litigate, efforts of governments to ensure that they protect their population. We seem to be having a situation evolving here where attempts are now being made to paint the whole issue of the measures implemented as being draconian, as being dictatorial, and that somehow, we're trampling on the rights of Guyanese as a nation, when as a government you attempt to do the things that will protect the population. The people who took the vaccines are people who want to protect themselves and who want to protect their families. And like I said at the beginning of the program, it is only fair that the government plays a role in ensuring that those who are making an effort to be protected are so protected. Um, so we are seeing statements emanating as though the government is somehow forcing people to take the vaccine by implementing certain measures. And we started on that basis, but I want to talk a little bit more, Dr. Anthony, about the measures and about the claim that somehow we are breaching the rights of people. And I'm seeing people like Coretta McDonald and the others talking about somehow the government is trampling on the rights of workers. So I'm going to start with you, Dr. Anthony, then I'm going to come to you, Minister, or Minister, you want to go first, and then Dr. Anthony?
Yes, yes, Eddie, because there's a thought in my head quickly. I want to put it out there to remind people there isn't any measure that Dr. Anthony has implemented under his hand on behalf of the government via gazetted order that is close to anything. If Guyanese would remember the first gazetted order under the hand of David Granger and Walter Lawrence, when the pandemic started, spoke to the fact that they could have gone and taken over your houses and burned it down. If you remember that, Dr. Anthony, some 18th century legislation was evoked to deal with this same pandemic, and Guyanese must remember that. There is no order like that that the PDP civic in government we have ever gazetted. Frank, I'm sure when he speaks, he will be able to outline in a better way. But that thought just came to me whilst you were talking, that there's a gazetted order, and Eddie, you and people in the journalistic field, you should go and get it and resurrect it and bring it to the public. And to let us, this order talk about going into houses and getting all that the belongings of the dead deceased and burn it, and families could not go to their funerals, and they're to be cremated and all that kind of thing. But I'm sure Dr. Anthony is in a better position to speak about this order matching many ones that he has been putting out.
Well, thank you very much, Eddie. I think the measures that you spoke about, they're very simple measures, really. The first one deals with access to restaurants and bars and casinos and so forth, because there are people who still want to have a social life. And while we initially we had put some restrictions about capacity, and that was only 40% of indoor dining was allowed, we have now in this current order changed that to 60%. So we are giving you more people can come in, but under the condition that these persons must be vaccinated. And if you are not vaccinated, and when the task force or one of the enforcement agencies randomly come and check, if they find unvaccinated persons dining, then the proprietor of that restaurant or facility would be guilty of an offense. And I think that's a fair um, way to go. As you can see, when we issue this order here on the 1st, we saw similar types of order being issued in different states in the US, for example. In New York, quite recently, if you are going to go into any indoor building, you must produce your vaccination card. If you're going to dine in some restaurant in New York, you have to show your vaccination card. You want to go to the gym, you have to show the vaccination card. You want to go to a bar, same thing. Similar measures have been taken in France, and Minister Hamilton just spoke about somebody taking the French government to court, and they lost the case because in a pandemic, our first um, action as a government must be to protect the population. And if these measures are going to help to protect the population, then the courts would always rule in favor of public health measures and in favor of saving people's lives. And that's what our measures are geared to do, to save people's lives, to encourage vaccination so that we can reach herd immunity and save people's lives. Now, another measure that we have in the order is to safeguard people who travel on public transportation. On a daily basis, we have thousands of people who would be using a minibus or who would be using a speedboat to travel from one place to another. And if these operators of speedboats and minibuses are unvaccinated and they're infected, they can pass that infection on to the people in these public transportation vehicles. And therefore, we have made it a requirement for minibus drivers and speedboat operators and conductors and so forth to get vaccinated. And I think any rational minded person would understand that this is a good public health measure and to safeguard the health of others that we need to implement this. So I don't anticipate that people will want to fight against a commonsensical measure like this. And I hope people understand that with this new variant is circulating called the Delta variant. If you're following the news and looking at what is happening in the United States, you would see how many people are going into the hospital and how many more people are dying. So if we want to safeguard our population, we need to take those measures now. If or when we get that Delta variant and we have a large percentage of people who are still unvaccinated, unfortunately, we'll have a lot of people who would end up in the hospital. And given the, the hospital beds that we have for COVID, we just might not have enough beds for all the people who would require such a service. So, yourself a favor. You have the opportunity now. Go and get the vaccine if you haven't done so. And that's basically what we're trying to encourage people to do. Don't
And
be
you
like
know,
the man that Mr. Hamilton spoke about on his dying bed, then texting to say he should have taken the vaccine.
and this whole talk about somehow the government is trying to force and to make vaccination mandatory. I think deliberately there are attempts to skew um, what what are the efforts of the government, because the notices that are being published by the various government ministries and agencies and departments made it clear that persons who are vaccinated are going to gain entry to these places and be able to conduct their business. And it also states clearly that persons who are unvaccinated will also gain access to these places to conduct their businesses. However, the condition is you're going to have to make an appointment. So this whole argument and this whole false narrative about somehow um, people are being denied the opportunity to, first and foremost, they don't have a choice of taking. You have a choice. If you don't want to take the vaccine, that's your choice. As harmful as it could be to you and to your family, it's a choice you have not to take the vaccine. However, you have to respect the decision and the decisions and measures implemented by individual agencies and businesses, etc., to protect those who are vaccinated and to protect them, against you being reckless and could possibly infect someone. So this whole argument, you have a choice, but you also have a responsibility that goes with that choice, and you also have to work according to the conditions that are set by individual businesses. I don't think any right-thinking Guyanese who's vaccinated, who's protecting him or herself from the virus, is going to be that reckless to say, I'm going to support you coming where I am, being unvaccinated, and knowing the potential of you being a carrier and you being able to infect me. And the issue here again, so you hear this argument all the time, Dr. Anthony and Minister Hamilton. But if you're vaccinated and then you're not going to get that sick, or there's a possibility you're not going to contract the virus, why are you afraid of unvaccinated people? You're afraid of unvaccinated people, or you protect yourself from unvaccinated people, because while you are vaccinated and while you could contract the virus but not get seriously ill, the possibility exists you can share that to maybe your children and others in your home who are not yet vaccinated, including particularly your children. So there is a possibility, I believe, Dr. Anthony, that you can share. So as much as you're vaccinated and you're protected, you may not get seriously ill. There are still consequences involved. There are still issues that have to be taken into consideration. So this whole argument about you being vaccinated, you shouldn't be fearful. Um, and also, before I bring you back in, I want to share again. I saw a letter in the Starbucks News today talking about vaccination and the importance of vaccination to pull us out of the situation we are in. While we were talking, I was going through and I was trying to read quickly the Spanish flu, Dr. Anthony, the Spanish flu, and the efforts then to create influenza vaccines and to protect people. So, being vaccinated against viruses is nothing new. And someone made the point earlier that we all, even as children, had our vaccines: measles, mumps, rubella. And the other thing is, many of us, when we're ready to travel, and the requirement is for us to have the yellow fever vaccine, we don't see a concern there. We run quickly to the Ministry of Health or to the nearest health center where we can get that vaccine, and we take the vaccine. But all of a sudden, a vaccine that you can receive that is going to protect you against a deadly virus becomes a problem. And it only became a problem because you have a bunch of people who are supposed to be leaders in the opposition camp who are working overtime day and night to spread misinformation, lies, and to lead many of their unsuspecting followers. And you made the point, Dr. Anthony, about the vaccination rate in places like Linden and so forth, are trying to lead their supporters down a path of destruction. It is funny. It's not really funny, but it's sad, and it sometimes forced you to think what really is the objective of people like Harman and the others. We're going to expose your supporters who are casting a ballot for you at the elections to ensure that you get votes. You're going to lead them down a road where they're going to be exposed to a deadly virus. That by itself doesn't make sense. One cannot really fathom, can't wrap your head around why such an irresponsible reaction from the opposition. We'll talk briefly, Dr. Anthony, a bit about Coretta McDonald's video that is circulating and her statements, but I'm going to bring you back here from there. We're going to go first,
No,
Dr.
I
Anthony.
think you have. I think you have emphasized the point that we need to have responsible leadership, especially with all the misinformation and so forth that is flying around. But even if there are a few people who are on that lunatic fringe where they want to go around and spread misinformation and cause confusion, we as a society, we need to ostracize them. We need to tell them this is not the time, this is not the place, and we just need to ignore them because they don't deserve to be leaders of this country if that is going to be the reckless and irresponsible behavior that they're demonstrating. Guyana deserve better people to be in those positions. So I think with this particular pandemic, there have been a lot of scientific information that has been around. I would want to urge people to go to those websites, to read the scientific information, and to get themselves educated. And don't listen to people who have no expertise or knowledge of any of these things. Don't listen to them because they can't enhance you know, your knowledge about these matters. Go to places that are authentic. Go to websites such as the CDC's website, WebMD or the Lancet or the New England Journal of Medicine or one of those, and you will get valid information pertaining to vaccination. And you can read all the things that you want to read there. And they have sites that dispel a lot of the myths, like the WHO site and so forth, that would dispel all of the myths. And you can find authentic information. Use that to make your decisions. Don't depend on people who, they got a political narrative and an objective. Don't depend on them. Just make sure that you go to credible and authentic websites to get your information. And I'm sure once you do that, you would be able to make the decision. And I'm sure that decision would be to go and get the vaccine. Because all the scientists and experts in the world can't be wrong. And they have spent decades trying to study these things. They've had experience. Some of them have developed vaccines and so before. And they're telling you about why this is good, why this is working, how it is working, and everything else. Sometimes we get carried away. I see you got some school dropouts who are now the experts on Facebook and other social media platforms. They suddenly become experts on vaccination, and they probably couldn't pass basic science courses when they were going to school. But now they're the experts. And if you're going to believe those persons as against the scientists who will spend their whole life studying these things, then we're in a bad shape. But I know that the Guyanese public, that they're smart people and they know that where to look for proper information. And that is why we have more than half of the population right now who've already received their vaccines. And we have to make sure that the others, we have a duty to influence the others so that they too can get their vaccinations. So this is a team effort. And those who don't want to play along, well, then let's leave them out for now. But we would get others to come on board as we are doing. Over the last couple of days, we have seen an exponential rise in people coming to get their first doses, and that's a good thing. And we want to see more of that so that we can get to herd immunity as quickly as possible.
Minister Hamilton, I'll give you the opportunity. We're almost out of time, so maybe you're going to give us the closing comments.
No, no, I mean, look, the same thing Dr. Anthony is making the point. All of the persons, they have a responsibility to themselves and to their families. So, yes, on the one hand, you have these wild men and wild women who are spewing foolish narratives. If you want to go down the road and believing the nonsense and you expose yourself and your family, who is to be blamed? And you know what? The same people who are attempting to challenge the measures put in place by the Ministry of Health and by the government by extension, if we did not do that, they would have cussed us out for not doing that. So these are the type of people you can't follow them up too much, as rightfully as Dr. Anthony has said. And we live in a country that is sometimes you wonder the strangeness of it. As Dr. Anthony just mentioned, you have ignoramuses who are experts on oil exploration and development. You have people who never planted one tree or even put on a faucet of water. They can tell you about the mangroves. They're experts on mangroves and so. They never planted one tree in their backyard, even though the land is there, so that they could grow a tomato or something like that. They are experts on what development and mangroves should not happen with development. So everything you have this kind of conversation, and in large measure, we have to continue to defend the government position and to present it and to educate people about what the real position and methods and what must be done. At the end of the day, we were tasked with the responsibility to govern, and govern we will. We have a responsibility, we have a duty to the people of Guyana to do everything necessary to protect them. And the final thing is, all these people who clamor about rights, what about my rights? What about us, our rights, Eddie, who have taken the vaccine? We have a right to protect ourselves. So, rights is not a one side. Human rights and constitutional rights is not for one set of people. Um, we have rights also. And
Well,
the government,
Joe,
yes, Frank, go ahead.
to enjoy your rights, you have to stay alive. And to stay alive, you need the vaccine. If you're dead, you can't enjoy no rights.
Yeah, all the rights you talk about and you clam about, you would not be here to enjoy the rights. So Eddie, we have to continue to move forward. And on behalf of the government, and I know the Minister Anthony every day, when he speaks to this matter, he continues to thank the Guyanese people and all the organizations and the doctors and nurses and all the people who have been involved from the outset to try to contain this pandemic and who continue to do give service. Those persons we have to pay a lot of attention to and to continue to thank them for the service whilst we deal with these crazy people at the same time. The persons who are giving service, they are more important in this regard in helping us to arrest this pandemic. And so we have to continue to remember them in everything we do, every time we speak. Uh, and that is what I'm attempting to do here tonight.
I want to thank you very much, Dr. Anthony, the Minister of Health, and of course, Minister Hamilton, the Minister of Labor, for joining me this evening as we share information, as we continue to do on every program, share information with the people of this country to educate them, to inform them of what is taking place. And we want to continue. I want to join with Minister Anthony and Minister Hamilton and encouraging the people of Guyana, those of you who are not yet vaccinated, to get vaccinated. The fact of the matter is, when you look at the statistics, the people who are being infected, who are ending up in the hospitals, and eventually some of them are dying, are people who are not vaccinated. The people who are vaccinated have a better chance of living, and there is very little, if not no evidence, of them becoming, those who have taken both doses, becoming infected with the virus again. You make the choice. All of us here on this program have been vaccinated, and we're healthy, and we're living our lives, and we're way safer. You have a responsibility not only to yourself to be vaccinated, but to your families, to your friends, and to every single person who you come into contact with on a daily basis, to protect them and to protect yourself. Gentlemen, it is indeed a pleasure to have you on the program this evening. We have to continue this conversation to educate people as we go along. So, again, gentlemen, thanks for being here.
Okay, thank you, Eddie. Good night, Frank. Good night, Eddie.
And thanks to our viewers. Have a good rest of the evening. Bye for now.